What is beauty? What is courage? What gives one strength to inspire? Let's talk Women Talk.
As the first female neurosurgeon in Nepal, Dr. Maya's dedication knows no bounds. After the earthquake in 2015, she has gone out of her way in helping others. Always committed to fighting for what is right, the compassion she exudes for everyone around her is truly remarkable. What motivates this incredible lady to go beyond her call of duty? So, Dr. Maya, tell us a little bit about how you became the first neurosurgeon in Nepal.
I started working in the neurosurgery department in Bir Hospital. They have a very good neurosurgery department there, and when I worked there, I got inspired by everybody working so hard and saving lives, which was impossible. There's a lot of mortality also in neurosurgery, but if the patient survives, it's a miracle. So I loved the feeling, and then I started neurosurgery.
Tell me a little bit about the work that you do at the Digayu Guru Hospital.
I work as a consultant neurosurgeon, so that means I see the cases here, inpatient and outpatient both. So I have a clinic and I see cases there, and also we have a ward where we admit the cases, and we do mostly elective surgery here.
Can you tell us a little bit about what you've done, and I mean maybe before the earthquake, and then we can talk about after?
Actually, I was not doing much. I was only doing some medical camps, 2 to 3 medical camps per year. During the earthquake, it was a very big disaster. I was not in Nepal during the earthquake. When I came back, one of my friends, he said, let's go to give the relief supplies to the outlying village because they were mostly badly hit. So I went with that friend, and that place, we saw a lot of devastations there. And I mean, there was not even one house standing on the way. The whole houses was collapsed. There was nothing there. And then we went, actually I went only to give the relief material. It started with one step, and then I joined another organization, and we went together with them, and then another and another and another, and then it was also not enough. So I started going on my own.
So, Dr. Maya, how has that entire experience, what has that told you about the spirit of the Nepali people?
I think all this disaster and all this going around in the villages taught me that Nepali people are very, very resilient, very tough, and very independent. I mean, the older you are, the more independent you are. Everybody had some advice to offer, you know. We are living in very harsh conditions, harsh environment. Everything is physical work. It's very tough. And if God gives more trouble, it's nothing, we can bear it. Even one person I met in one village in Bhimtar, the one person who was so active doing everything was wearing white. You know, in Nepal, you wear white for mourning. If your family members die, you wear white. And he was so cheerful, he was helping everybody. He was not only thinking about his own village, he was thinking about another village. And he said, you know, during the earthquake, his wife, his 2 children, all died.
After post-quake, how has that changed you as a doctor? And a person?
Yeah, in a person, because I used to think only in medical terms, you know, about the patient, the outcome of patient, and the treatment of patient, and what is good for the patient. But after going to the villages, now my, horizon has broadened or something, because now I have to think about my village, my country, my region. It's not only my patients and medical diseases, but I have to fight so many other social problems also. Because the more I went to the villages, the more social problems I saw.
Now, I know also that you are now currently trying to adopt an 11-month-old girl. Can you tell us a little bit about how she came into your life?
She was brought to the emergency department of that college with a severe head injury. He found the child was thrown out from the 2nd floor window by a drunken father, where the father was fighting with the mother, and he was beating her, I suppose. So the mother was fainted. The mother fainted. The child was crying, so he threw the child out of the window. And at first we thought the child would not make it because she had already undergone CPR. But the child survived, and slowly she recovered. And it's already been 3 months that we are taking care of her. I'm trying to adopt her because to give her back to the family is like letting her die, because the mother cannot protect her. The father is already addict and maybe alcoholic, and maybe is used to doing all these things. So I think the only option is to adopt her. I've already asked for the legal custody.
What made you want to do this for this girl?
If it happens once, it always happens, second time and third time. And then each time the child's damage is more, and there comes a time that you cannot save the child. It already happened, one girl, her name is, I still remember her because she was so cute, she was so tiny. Her name was Putali. Putali means doll in Nepali, and her father beat her up and threw her, and she sustained a very severe head injury. And it happened before also, but the second time that happened, the damage was severe. We could not do anything. I talked with the police officer in charge at the time also, and they said that the child always goes back to the family. You cannot take away the child. So this time I thought maybe, this time I'll try to fight for the child, because it's always happening. If nobody does anything, this child would also die. So this time, I hope that I'll be able to adopt her. Then maybe I'll be able to save her. Because if she goes back again to that family, you don't know what will happen. It took me seven other kids before I took a stand. It's already 7 kids. It's only me who saw 7 kids. Maybe my colleagues are more. And who are doing anything. We are not doing anything for anyone. It's our failure, I think. We always ask other people for help, but we are not doing anything ourselves. And I think that's the biggest failure.
Does situations like that make you feel helpless, or does it give you strength?
First, I was helpless. Then I was frustrated, defeated. And now I'm trying to fight.
What is empowerment to you, Dr. Maya?
Empowerment is like being able to do what you feel is right, irrespective of your education, your position, your status, economic condition. If you're able to do what is right in your mind, that is real empowerment.
That's amazing. This is really one of the most humbling interviews I've done. And really I really admire who you are, what you stand for. And really thank you for everything that you've done and you are going to continue to do for the people. And thank you for inspiring all of us as well to really look beyond ourselves.
I think it's my patient who inspires us.
While her patients continue to inspire her, Dr. Maya has now become the inspiration for her friends and colleagues.
Dr. Maya, she's a very good human being. I have a very good memory of her, and I always cherish Dr. Maya as my friend, very good friend, as my guide. She's senior to me, as like a shooting star. She always guides me, and above all, she's a very good human being, and she's a very generous, and she's a very good social worker.
Fighting for what she believes in is not easy, and Dr. Maya has shown true courage and humility in redefining what it means to be a medical doctor. She exemplifies that one person's desire to bring about change can indeed transform not only a child's life, but possibly a nation's future.